Hello and welcome to episode 102. And today we're going to be talking about Liu Jun Zi Tang. Liu Jun Zi Tang, our Six-Gentlemen Decoction. One of my favorite formulas. Well, let's do the introduction in just a second. I'm really glad you guys are here listening. So today's episode, we will be exploring one of the most important Chinese herbal formulas, Liu Jun Zi Tang, or Six-Gentlemen Decoction. This is a very common formula used to treat qi vacuity with dampness, phlegm as well. We'll see why phlegm is in there and dampness. We'll be doing our deep dive into this formula and find out if there's any evidence for these effects. And as usual, we will be adding something a little different. We're going to discuss evidence levels of clinical research. It's going to be another fascinating expedition into the deep sea of herbs. Please join us today. Before we get started, I wanted to talk to you about an exciting new special we have going on. It's an amazing special for our courses. If you use them for continuing education, professional development, or just for your own edification, we are offering 50 hours of courses for an unbelievable price. Normally this would cost $750. However, with the special code 50CEUS, that's 50 CEUs, this is going to be only $325, or only $6.50 per hour. Plus, and this is a huge plus, you can get a free signed copy of one of my books. Just pay for shipping and handling. That is a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. And I'm not even sure how much the Integrative Pharmacology book costs, and if I could read, there is, that's $74.95 normally. So almost a $75 value for free by doing this. So that's a huge special. Just go to the webpage www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org/CEUS1. That's integrativemedicinecouncil.org/CEUS1, CEUS1. And you can get this amazing deal. And there's another deal. If you don't want 50 hours, you don't want that, you don't need that many, then there's another deal on there as well. So get a fantastic value on the books as well. So check it out. integrativemedicinecouncil.org/CEUS1. So let's talk about evidence-based medicine levels real quick. If you're watching this live, next week I'm going to be doing one of my most popular courses. I've been doing this, I think for not quite 20 years, probably about 17 or 18 years at this point. It is still one of my most popular courses. 9 drugs and 10 herbs to worry about. Long ago, I changed it from 9 drugs and 10 herbs to 10 drugs and 10 herbs. So these are the 10 drugs and the 10 herbs that you need to worry about. Didn't change the name because then I have to go through a lot more paperwork, so I just kept it for the years. So you get a bonus drug in there. So 9 drugs and 10 herbs to worry about. Many years ago, I wrote an article with a subset of the 10 herbs called 4 Worrisome Chinese Herbs. Over the next 2 episodes, we will revisit that article. And today, we're going to talk about evidence levels. If you want to learn about all 9 drugs and 10 herbs to worry about, check out my course at that integrativemedicinecouncil.org website. So www.integrativemedicinecouncil.org. And that's enough of the sales pressure here. By doing research on applying evidence-based medical levels to drug-herb interactions, I have found there aren't very many interactions that are above the lowest level of evidence. In fact, out of approximately 1,000 drug-herb interactions, that was in my first book. I've added a lot more to that, and maybe even doubled it, as I'm working towards my 3rd edition of that book. So there's a lot more drug-herb interactions. But in the first book I did, there are 1,000, exactly 1,000. I counted them. I couldn't believe it was exactly 1,000. I counted them again. I only found 56 out of 1,000 that were above D level, the lowest level of evidence. A little over a third of these involved ma huang or ephedra herba, which we know is banned in the U.S. and I think other developed nations as well, as a very dangerous herb. I don't agree with the ban. I don't think it's dangerous if used properly, but when used improperly, yeah, I think it's dangerous. So a third of those 56, almost 20 of them, were involving ma huang. Only 2 were A level, which is the highest level. 18 were B level, and the rest were C level. So even among those 56 that were above D level, most of those are C level. So not the strongest evidence for drug-herb interactions. Not that they don't happen. There's lots of reasons for this, which we're not going to get into right now. Obviously, these numbers are not static, and there's always new research, but these at least give us a good feel for what may be an important drug-herb interaction. So this kind of came about just real briefly here because when I was writing my book, Integrative Pharmacology, Combining Modern Pharmacology with Integrative Medicine, the whole idea was to look at drug-herb interactions. And when I did that, I came up with a list of drug-herb interactions, and my publisher was a little concerned. He's like, hey, this is Bob Flaws and Honora Lee Wolf, Blue Poppy, and Bob was, hey, I'm a little concerned about this. Like, I feel like this book could be used against us as a profession. Like, if you're just listing them as a drug-herb interaction, then someone looks it up, you've used it, you're in trouble, sort of thing. And I said, well, you know what? I actually thought about that, and what I wanted to do was add in evidence-based levels to the interaction, so we know how strong or not these interactions were. But I ran out of time. I had a deadline, and I couldn't get those in. And he said, you know what? That's so important. We're going to postpone the deadline. Let's get those into these drug-herb interactions. I said, fantastic. That's where I wanted to be. And so I worked hard for the next, it probably took me about another 6 months, and got all these evidence levels into the book. And I'm super happy. I think it makes it 10 times stronger to have these evidence levels. And I was very thankful to have that support from the publisher to do that. So that's where this all came from. So, I said we need to feel for how important these drug-herb interactions are, and that comes from these evidence-based levels. So as may be inferred, there are many levels of evidence according to the Oxford Center for Evidence-Based Medicine. Now, I don't know if you guys are old enough. I don't know if it is currently. I know when I was kind of going through school, you said evidence-based medicine to Chinese students, Chinese medical students, and they're like, oh, I don't believe in all that. It's just all science, and they would mumble about it. But it really is a good framework to know what is important research or not. And that's really all that we're talking about is this research we as practitioners should be paying attention to or not? That's what these evidence-based medical levels are about. And the way it's done is first, each individual research paper is given a level of from 1 to 5. And 1 is the highest level of evidence. It's broken down into 1A and 1B, and I'm just kind of sharing these to get what it takes to have a really strong research paper. And 1A is a systematic review of random controlled trials or RCTs. Now, if you've had a science course, and a lot of us have our doctorates in Chinese medicine at this point, at least in the U.S., and I'm sure you've had a research class either then or in your master's program. We always hear that randomly controlled, double-blinded randomly controlled trials are kind of the pinnacle of trials. That's true. They are the pinnacle of trials, but they're not the pinnacle of evidence. A systematic review is. A systematic review of those randomly controlled trials is high-level evidence, and that's what 1A is. 1B is an individual randomly controlled trial with a narrow confidence interval. In other words, it's large enough and well done enough that we actually, and this is statistically derived, it has a narrow confidence interval. In other words, the chances of it not being true are minimal. And so you can't have a very strong RCT as a level 1, but the highest are systematic reviews, meta-analyses. I'm not going to get into all these. 2 and 3 are less than that. 4 is where there is some clinical evidence, either case series, poor quality cohort, or case control studies. That is a level 4 evidence. And level 4 is the minimum. The reason why I mention it here is like the minimum to be clinically relevant. Like it's happened in humans. That's level 4 evidence. And then 5 is an expert opinion without explicit critical appraisal or based on physiology bench research. And in this regard, animal research falls under this category of bench research. So level 5 means not clinical. It hasn't happened in humans. And that's incredibly important. It's great that a study shows, hey, this herb and this drug interact in rats or in mice or in rabbits or whatever. That's nice to know. That gives us a pointer as to where we might want to put some efforts into looking at human research. But it isn't human research. And just because it happens in a rat does not mean it's going to happen in a human. In fact, it very often doesn't. So level 5 evidence is the lowest level, not a clinical evidence. Then, after we look at these individual research papers, then as an aggregate, based on these individual papers, an overall evidence level is given to the interaction from a grade A, which is consistent level 1 studies, the highest level, to grade D, level 5 evidence or troublingly inconsistent or inconclusive studies of any level, and is the lowest level. So it goes from A to D. And remember what I said earlier, almost 95% of the interactions I came about were level D, this lowest level. And just like we just said, level 4 is minimum for a clinical, for being in humans. C is minimum for being in humans. D means no human evidence. So some of these, you go, okay, this guy's a real expert and it seems logical. And so maybe we shouldn't be doing that. So, a great example of this is warfarin. There are lots of human studies that show some warfarin interactions, but because of that, because of what we know about warfarin being a narrow therapeutic index drug, we know that it's probable that other herbs will interact with it, even if we don't have any direct evidence. So even though that's level D evidence, that's an opinion, it's something I wouldn't break as a practitioner necessarily. So sometimes we do listen to level D evidence, but a lot of times generally it's not humans, it doesn't happen to humans. So that's the difference between level A through D. The other issue is that just because an interaction exists does not mean it is particularly bad. Some interactions actually enhance the effects of the constituents. They're still classified as interactions, but they're positive interactions. So that's a thing here as well. The other thing I'd like to say is, even if something is incredibly likely to cause an interaction, that percentage might be 5 to 10% of the people who take that herb in that drug might have an interaction. That's really high in my book, that an interaction can happen. In other words, even when there's a high likelihood for an interaction, it's still very uncommon that it would occur. The problem is, if we know that it does occur, it can occur, we can get in trouble if it does occur. So I wouldn't be playing with fire in that scenario either. So this is a brief introduction into evidence-based levels. In our next episode, we will look at the 4 worrisome Chinese herbs using these levels. So we're just kind of setting the tone for this. Now, let's talk about today's formula. Liu Jun Zi Tang, or Six-Gentlemen Decoction. This formula is an interesting one. It is a modification of another very important formula, Six-Gentlemen Zi Tang, or 4-Gentlemen Decoction. So as you can imagine, 4-Gentlemen Decoction has 4 herbs. Liu Jun Zi Tang, or 6-Gentlemen Decoction, has 6 herbs. So you add 2 herbs to 4-Gentlemen Decoction, and you get 6-Gentlemen Decoction. Even though it is a modification of another formula, it is a very commonly used formula in its own right. Six-Gentlemen Zi Tang is the standard formula for tonifying qi, while Liu Jun Zi Tang is the formula for treating qi vacuity with dampness, and as I've said already, and phlegm as a possibility as well, dampness, phlegm, and those can be related as well. This dichotomy is also front and center of our 2 usual formulas textbooks, Chinese Herbal Medicine Formulas and Strategies by Scheid and his team, says Liu Jun Zi Tang is a modification of Six-Gentlemen Zi Tang, while Chinese Medical Herbal Formulas and Applications, Pharmacological Effects and Clinical Research by Chen and Chen says Liu Jun Zi Tang is a mainline formula of its own. It is not under Six-Gentlemen Decoction as a modification. It is its own main formula as its own. And I think that is sort of how we approach this to a certain extent. This is a very important formula that is a modification of Six-Gentlemen Decoction, but also a standalone formula on its own. It's important enough to be a standalone formula. Scheid and his team says this about the name and Six-Gentlemen Decoction. Traditionally in China, a gentleman was a person whose virtue and achievements made him stand out from the common people. From the Confucian perspective, becoming a gentleman implies a process of self-cultivation through which one develops a rounded personality. The four herbs of which this formula, again, this is Six-Gentlemen Decoction rather than Liu Jun Zi Tang. The four herbs of which this formula is composed are balanced and harmonious, and therefore have the qualities of a gentleman, as explained by the Qing Dynasty writer Zhang Lu. For qi deficiency, one tonifies using sweet herbs like ginseng radix, renshen, atractylotus macrocephalae, rhizoma, baiju, poria, fuling, and glycericerae radix, gansao, licorice. Sweet and warming, they augment the stomach. They thus have the ability to strengthen the transportive functions of the middle burner. As they all have the virtue of being thoroughly harmonious, they are considered gentlemen. So that's where that name comes from. Other names include Liu Jun Zi Tang or Wan. So I think Liu Jun Zi, this is just the difference between Pinyin and Wei Giles. So instead of Jun for Jun, it's Chun. Instead of Z, Zi, it's Tzu, and that's Wei Giles differences, which is just another way of romanticizing, putting into Latin characters Chinese words. And it has in parentheses Wan, so normally we say Liu Jun Zi Tang, which means decoction. Wan means pill, so it can be a pill as well. It can also be six major herb decoction or pill, Six-Gentlemen Decoction or pill, and major six herb combination. So these are all different names for the same, or maybe you can even say different translations for the same formula. This formula is in the subcategory of formulas that tonify the qi under the categories of formulas that tonify. Our other textbook, that's from Scheid and his team, our other textbook, Chen, says it is in the qi tonifying formulas subcategory under the tonic formulas category. So it says basically the same thing. They may have a slightly different translation, but it means the same thing. So let's talk about these formulas that tonify. So Scheid et al., as usual, describe the overall category in the following way. The formulas in this category are used in treating various forms of deficiency by tonifying, augmenting, nourishing, enriching, fortifying, or supplementing the qi, blood, yin, or yang. Among the 8 methods of treatment, the formulas here belong to the tonifying method, or Bu Fa. Early references to this method of treatment can be found in many passages of the basic questions. Now, when we say basic questions here, what we're actually referring to is the Huangdi Neijing Su Wen, which is the Yellow Emperor's Classic, which is the first existing. There were probably other books maybe before this, but this is the one we still have today. First existing book on Chinese medicine, and it's broken down into 2 parts, and the Ling Shu and the Su Wen. And so here we're talking about basic questions, the one part of the Su Wen. So for example, here are some of these references. Chapter 20 admonishes, tonify that which is deficient, while chapter 74 advises, augment those who suffer from harm, warm those who suffer from overexertion. And chapter 5 notes that when the form Xing is insufficient, one warms by means of the qi of herbs. When the essence is insufficient, one tonifies by means of the flavor of herbs. So there are just some basic references to tonifying. The classic of difficulties are the Nanjing, written in the Eastern Han period from about 25 to 220 CE, elaborated on these pragmatic instructions by tying the idea of tonification to the doctrine of yin and yang organs. When the lungs are harmed, augment the qi. When the heart is harmed, regulate the nutritive and protective qi. When the spleen is harmed, regulate the diet and adjust exposure to heat and cold. When the liver is harmed, relax the middle burner. When the kidneys are harmed, augment the essence. So, and that's from chapter 19 of the Nanjing. So, if you have a good background in Chinese medicine, that makes a lot of sense. These are the 5 major organs of the body, and this is referring to a lot of the functions of those organs as well. So this makes a lot of sense from a Chinese medical perspective. The text also, so going back to Scheid, text also applied the 5-phase doctrine as a model from which general treatment strategies could be deduced. The principle for deficiency, tonify the mother, in chapter 75, continues to be applied in contemporary practice. This means that one should tonify the organ that corresponds to the phase that precedes that of the deficient organ in the cycle of mutual generation. For example, the kidneys water are tonified by treating liver wood deficiency, and the spleen earth is tonified for treating lung metal deficiency. This principle may be applied even when the situation does not adhere strictly to 5-phase criteria. Example is that of tonifying the gate of vitality, the kidney fire, rather than the heart fire phase in treating deficiency of the spleen earth. That tonification was an important concern to physicians early in the history of Chinese medicine. Let me reread that. That tonification was an important concern to physicians early in the history of Chinese medicine, can be discerned from an analysis of the herbs discussed in the Divine Husbandman's classic of the Materia Medica. That's the Shendang Ben Cao Jing. We talk about that quite a bit. That is the first existing book on single herbs. And so in that book, about 20% of these are what would today be classified as tonifying herbs. On the other hand, tonifying formulas are relatively rare in such early medical classics as Discussion of Cold Damage, Shanghan Lung, or Essentials from the Golden Cabinet, the Jingui Yao Fei Yung. So these are the earliest books on Chinese formulas, the Shanghan Lung and the Jingfei. I can't say it anymore. Jing Luo. The Essentials, the Golden Cabinet. There we go. I'm just starting to show my age here. Getting all tongue twisted. So those are the older books, the oldest books existing on formulas. So we can see that the tonification isn't as important in there. The majority of well-known formulas in use today were composed in the period from the Song to the Ming dynasties. The Song dynasty formulas from benevolent sages compiled during the Taiping era, also in Chinese Taiping Shong Hui Fang, written in 992 CE, for instance, contains the classic formulas for Gentlemen Decoction, Six-Gentlemen Zi Tang, for Substance Decoction, Si Wu Tang, Ginseng Poria and White Attractor Lotus Powder, Shengling Baiju San, an all-inclusive great tonifying decoction of Sichuan Dabu Tang. During the same period, the pediatrician Qian Yi composed a number of formulas for tonifying deficiency of the 5 yin organs, including the famous 6-ingredient pill with Romania, or Liu Wei Di Huang Wan. During the Jin Yuan dynasties, Li Dong Yuan emphasized the role of the spleen and stomach in formulas like tonify the middle to augment the qi decoction, or Bu Zhong Yi Qi Tang, for tonifying the qi, and Dongui decoction to tonify the blood, Dongui Bu Shui Tang, Bu Shui Tang, for tonifying the blood. At present, tonifying formulas are used not only to treat illness, but also to increase resistance to disease, improve performance, and deal with the side effects of biomedical interventions such as chemotherapy or radiation therapy. Their undoubted benefit in these and other areas of contemporary practice should not distract us, however, from the fact that, like any other medical intervention, tonification must be used responsibly, and that, if used incorrectly and without regard to pattern differentiation, it can cause its own side effects. Manifestations of deficiency are quite diverse and can arise in a wide variety of contexts. They may be due to constitutional factors, bad diet, overwork, emotional stress, trauma, illness, as well as the side effects of medical treatment. Patterns of deficiency patterns, that is what the book said, by the way, this is a quote, patterns of deficiency patterns can be differentiated by aspect, yin, yang, qi, or blood, or a combination of aspects, yang and qi, yin and blood, by organ, liver, heart, spleen, lungs, kidneys, or a combination of organs, liver, kidney, spleen, lungs, or by both aspect and organ, lung qi deficiency, kidney yang deficiency, etc. Because these formulas are designed specifically for conditions of deficiency, it is essential that deficiency and excess be properly differentiated. Conditions due to severe excess sometimes resemble those from deficiency, manifesting in such symptoms as weight loss and reduced vitality. This is clearly analyzed in another passage from collected treatises of Zhang Jing Yue, also in Chinese Jing Yue Chuan Xu, from 1624. Extreme deficiency disorders sometimes turn into their opposite, exhibiting an exuberant force, while strong excess disorders may conversely manifest with marked emaciation. One must not fail to differentiate these. Disorders arising from the seven emotions, overeating, exhaustion, or damage due to overindulgence in alcohol and sex, as well as those disorders occurring because of insufficient prenatal endowment, all frequently manifest with patterns including body fever, constipation, upcast yang, distension, fullness, deficiency mania, or false macules. That's red spots. Although they resemble disorders characterized by surplus, their excess is due to insufficiency. Remember also that chronic conditions are not necessarily due to deficiency, nor are all deficient conditions chronic. It's not uncommon for an externally contracted disease to injure the qi, blood, yin, or yang. In such cases, one should combine ingredients that expel the pathogenic influence with those that tonify. Tonifying formulas have very specific effects and indications. They should therefore not be used indiscriminately, like vitamins, just because it is assumed that everyone can use a little tonification. This is not true. Side effects will often develop when tonics are prescribed for those who are not suffering from deficiency. These include fever, headache, rash, pimples, insomnia, irritability, and digestive upset. The rich, cloying nature of tonifying herbs places a burden on the digestive system. It is therefore usually necessary to add ingredients that promote digestion and assimilation, such as those that strengthen the spleen, harmonize the stomach, and regulate the qi. It is also advisable to reduce the dosage of tonifying ingredients for patients with marked spleen and stomach qi deficiency. Furthermore, it is essential that the dosage be adjusted to the relative severity of the condition. Mild chronic conditions require a smaller dosage than do acute life-threatening conditions. Tonifying formulas are generally cooked for a rather long period of time over a low flame and are taken on an empty stomach to realize their full effect. Of course, these rules do not apply in emergencies. And that's our introduction to formulas that tonify in general. Let's briefly talk about formulas that tonify the qi, this subcategory under that category. Shai and his team continue to describe this subcategory. Formulas that tonify the qi are primarily used in treating conditions that involve the spleen and lungs. These organs produce the body's qi, which is derived from food absorbed by the spleen and from air taken in by the lungs. General symptoms of qi deficiency include lethargy and fatigue. An important hallmark of disorders associated with qi deficiency is that they are precipitated by activity and improve with rest. The spleen and stomach, located in the middle burner, are the source for the production and transportation of qi and blood. If the spleen is deficient, the qi in turn will be deficient. Similarly, for tonification of the qi of any organ to be effective, the spleen must itself be tonified and strengthened. When the transportive function of the spleen and stomach is healthy, the normal qi will be abundant. The primary indications of spleen qi deficiency include fatigue, shortness of breath with little exertion, laconic speech, a shiny, pale complexion, reduced appetite, loose stools, and a weak pulse. When qi deficiency is accompanied by qi stagnation, acrid herbs that facilitate the spleen's functions of assimilation and transportation, such as Cichia reticulata pericarpium or Chen-Pi, that's tangerine pill, Auglandia radix muxiang, or Momi fructus Sha-Ren, that is cardamom, are usually added to tonifying formulas. The qi of the spleen and stomach is also known as the middle qi. In addition to controlling digestion, the middle qi has many other functions that are related to its pivotal role in the ascending and descending actions of the qi mechanism. When the qi of the middle burner is deficient, it will manifest above in symptoms of shortness of breath and laconic speech, and below in symptoms of prolapse, bleeding, and incontinence. Tonifying the middle qi will raise the sunken yang qi and thereby restore the qi mechanism. Herbs that facilitate the upward movement of qi in the body, such as Bupleri radix chai hu, Simicifuga rhizoma shengma, or Sapashnikovia radix feng feng, are commonly added to formulas that treat these patterns. Lung qi deficiency manifests as chronic cough accompanied by generalized weakness, a low voice, and profuse sweating. The lungs control the skin and the interstices and pores. Because the fluids may be injured by profuse sweating, these formulas also address the effects of injury to the yin and fluids by adding yin tonifying herbs like Ophioplagonus radix Maimendong, or Glenia /Adenophora radix Sha-Shen, and astringent herbs like Schisandra fructus Wuedza or Mume fructus Wu-Me. Tonifying the qi and yin firms up or consolidates the protective qi and thereby helps reduce sweating. This gives these formulas a stabilizing effect. When the spleen and lungs lose control over water metabolism, leading to the accumulation of internal dampness, herbs that leach out dampness and facilitate water metabolism are added to qi tonifying formulas, which is basically what we're doing today. When qi deficiency leads to or is accompanied by blood deficiency, blood tonics are added. Because qi deficiency implies an inability of the qi to move substances in the body, the dosage of these herbs should be kept low in order that their greasy nature not obstruct the qi dynamic. For cases when deficiency of heart qi, usually more complex because of the heart's close relationship to the blood, the reader is referred to those formulas which tonify the blood and calm the spirit. For conditions with deficiency of the kidney qi, including kidney yang deficiency and unstable kidney qi, consult the formulas that tonify the yang and stabilize and bind. And that's it for our formulas that tonify the qi, the subcategory our herbal formulas in today. Let's talk about what our herbal formula does. So what are its Chinese medical actions? Scheid et al. Say this formula strengthens the spleen, transforms phlegm, and stops vomiting. And Chen say it strengthens the spleen and stomach and regulates qi and stops vomiting. So we have stopping vomiting quite a bit here. So what are the indications for this formula? So that was what its functions are. What are its indications? Scheid et al. Say this formula can be used for concurrent deficient spleen qi and phlegm characterized by a loss of appetite, nausea or vomiting, focal distension, and a stifling sensation in the chest and epigastrium, and often coughing of copious, thin, and white sputum. Chen say spleen and stomach qi deficiencies accompanied by dampness and phlegm include with symptoms like lack of appetite, loose stools, nausea, vomiting, a feeling of oppression and distension in the chest and epigastrium, coughing, and profuse white watery phlegm. Those are our indications for this formula. What's the history of this formula? So Scheid et al. And Chen do not agree on the source for this formula. Scheid et al. Say it is first mentioned in the formulary of the pharmacy service for benefiting the people in the Taiping era, Taiping Hui Min He Ji Ju Fang, written in 1107, while Chen Chen, however, say it first appeared in Fu Ren Liang Fang, Fine Formulas for Women by Chen Ziming in 1237, so 120 years later. So, whenever you see a discrepancy like this, my first thought is go with whoever's earlier. And since Scheid actually quoted that book in some of the things we talked about already, I would tend to think they're probably more correct in this. There have been times I think Chen Chen's more correct. It's just, I'm not a historian of Chinese medicine, so it's hard for me to get into it, especially with, I have had several years of Chinese, nowhere near enough to be able to research this in the original Chinese. So I do not profess to know how to deal with this discrepancy. Let's talk about the ingredients in this formula. This formula combines the principal formula, Six-Gentlemen Zi Tang, with 2 aged herb decoction, or Chen Tang. Chen Tang, so I said Six-Gentlemen Zi Tang is sort of the stereotypical, the sort of the classic formula for qi deficiency. Chen Tang is sort of the classic formula for phlegm. So we're combining that, and we get this formula then that treats qi and phlegm. At present, Cotinopsis radix, Dong Shen, is usually substituted for ginseng radix Ren Shen at 2 to 3 times its dosage, and the dosage of the other herbs is commonly increased by 1.5 to 2 times. Compared to the principal formula, the dosage of attractive lotus, macrocephalae, rhizoma, baiju, here is increased, and 2 drying herbs that direct the qi downward are added. In addition to tonifying the qi, this focuses the formula's action on removing obstruction in the middle burner by phlegm dampness, characterized by rebellious qi of the stomach and lungs. When discussing the ingredients, their function within the formula is taken from Scheid et al.'s formula analysis of Six-Gentlemen Zi Tang. So again, they're really good at analyzing the individual herbs in formulas, and they don't do that in modified formulas. So even though there's a lot more in this modified formula than most modified formulas, they did not have a breakdown of the individual ingredients. So I went to the primary formula, which is Six-Gentlemen Zi Tang. First herb here is ginseng radix Ren Shen, and Bensky says 3 grams. But remember, he said they said we're going to be using 2 to 3 times of Dong Shen instead of Ren Shen. Chen and Chen likely also say 6 grams, and then in brackets they have 9 grams. In the brackets is what they suggest for a decoction. The 6 grams is if you're going to do it in a pill or something else more traditional. And ginseng radix Ren Shen is from the tonify qi herbs category. According to Bensky and their team, which is our individual herb text, Ren Shen has the following actions: powerfully tonifies the primal qi, strengthens the spleen and tonifies the stomach, tonifies the lungs and augments the qi, generates fluids and stops thirst, benefits the heart qi, and calms the spirit. The chief herb in this formula is sweet, warm ginseng radix or Ren Shen, a powerful tonic for the spleen qi. Most modern formulations, however, Cotinopsis radix Dong Shen is substituted, both because it is well suited for this pattern and is significantly less expensive, though I'm finding the cost of Dong Shen is way up there from a while ago. Our next ingredient is attractive lotus macrocephalae rhizoma, or baiju. This is white attractive lotus, and again we have all these different doses. Scheid says 4.5 grams. Chen say 6 grams with 9 grams in brackets. I think 9 grams is probably appropriate for a decoction. Herbs that tonify, and this is also from the herbs that tonify the qi category. This herb tonifies the spleen and augments the qi, dries dampness and promotes water metabolism, stabilizes the exterior and stops sweating, and calms the fetus. And its role in this formula: the deputy bitter and warm attractive lotus macrocephalae rhizoma baiju strengthens the spleen and dries dampness. These 2 herbs, baiju and Ren Shen, work synergistically to improve the transportive and transformative functions of the spleen, that is, the spleen qi. So that's our second herb. Our third herb is Poria Fu Ling, and again we have 3 grams from Scheid. 6 grams from Chen Chen with 9 grams in brackets. And I think that one in brackets is probably where we want to be for decoctions in general. And this is from the herbal category of herbs that drain dampness. And its functions include promotes urination and leaches out dampness, strengthens the spleen and harmonizes the middle burner, strengthens the spleen and transforms phlegm, quiets the heart, calms the spirit. And its role is the assistant herb is Poria Fu-Ling, a sweet, bland substance that leaches out dampness. It also assists the chief and deputy herbs in strengthening the spleen. Our 4th herb is Glycericerae radix preparata, or Zhigancao. This is honey fried licorice, and we have 3 grams, 3 grams, and 6 grams would probably be the decoction dosing. And this is also from the category of herbs that tonify the qi. This herb is prepared with honey, which significantly increases its ability to tonify the middle, augment the heart and spleen qi, and harmonize the properties of other herbs. Its role: the envoy, Glycericerae radix preparata Zhigancao, warms and regulates the middle burner. The combination of these 2 herbs is instructive. Poria Fu-Ling moderates the cloying nature of Glycericerae radix preparata Zhigancao to prevent abdominal distension, while the tonifying properties of Glycericerae radix preparata Zhigancao moderate the draining properties of the former ingredients. So they're a great combination here. Our 5th herb is Cichia reticulate pericarpium, or Chen Pi. Again, we have 3 grams, 3 grams, 9 grams. So I'd say anywhere from 6 to 9 grams is appropriate for the decoction. And this is from the category of herbs that regulate the qi, or move the qi. Its functions include regulates the qi, adjusts the middle and relieves the diaphragm, dries dampness and transforms phlegm, and helps prevent stagnation. This is one of the 2 ingredients added to Six-Gentlemen Zi Tang, or 4-Gentlemen Decoction, to make Liu Jun Zi Tang, or 6-Gentlemen Decoction. And our 6th herb is Pinellia rhizoma preparatum, or Zhi Ban Sha. And we have 4.5 grams, 3 grams, 12 grams. I think probably 9 grams is appropriate, up to 12 grams as a decoction ingredient. And it's from the category of warm herbs that transform cold phlegm. And its normal functions are dries dampness, transforms phlegm, and causes rebellious qi to descend, directs rebellious qi downward and stops vomiting, dissipates nodules, and reduces clumps. And this is the other of the 2 ingredients added to Six-Gentlemen Zi Tang to make Liu Jun Zi Tang. So how do we prepare this? So Shahid and his team discussed preparation of this in Six-Gentlemen Zi Tang. Decoction. The source text advises to grind equal amounts of the ingredients into a fine powder and take 6 grams as a draft, either with plain or slightly salted water. So sorry, that wasn't decoction. It need not be taken at any particular time. At present, it is usually prepared as a decoction. There you go. There's the decoction part. Chen Chen says the source text states to prepare the ingredients as a decoction with the addition of small amounts of Shenjiang Rhizomus gingivaris recens, that's fresh ginger. It says 3 slices. And Dazao fructus jujube, that's Chinese dates, 2 pieces. Today, the decoction may be prepared using the doses suggested in brackets, as we've been talking about. So really, that's it for preparation. So let's talk about some commentary. When it comes to commentary, since this is a modified formula in Shahid et al., they do not have any commentary. Having said that, the commentary for Six-Gentlemen Zi Tang, or 4-Gentlemen Decoction, is excellent. I will discuss that here. However, we have to keep in mind this discusses the primary formula without the Cichia reticuli pericarpium Chen Pi, or Pinellia rhizoma preparatum Zhi Ban Sha. So this is that commentary. This is one of the basic formulas for tonifying the qi. Feibo Xiang even referred to it as the gold standard Jinke Yulu for all such formulas. Its distinguishing characteristic is its harmonious and moderate nature. Unlike many of the other qi tonifying formulas, which are quite warm and drying, this one opens the qi dynamic without relying on acrid qi moving herbs. The original instructions for use of this formula, relying on a dosage that is far lower than is generally used nowadays, further underlines this moderate mode of action. In some ways, this formula can be viewed as a modification of regulate the middle pill, or Li Xiangguan, with poria, fuling, substituted for zingiberis rhizoma ganjian, which is dried ginger. This is an example of how the substitution of a single herb can change the basic nature of a formula, in this case from one that dispels cold from the middle burner to one that tonifies the spleen. As is usually the case in contemporary practice, the precise mode of action of the formula is further modified by adjusting the nature of the individual ingredients to fit the presentation of the patient. As explained earlier, Codenopsis radix Dongshen is commonly substituted for ginseng radix Renshen. However, if the formula is used to treat deficiency of primal qi, this substitution is not recommended. If dampness is pronounced, unprepared Atractylotus macrocephalae rhizoma baiju is used. It is made the chief herb of this formula by increasing its dosage. Moreover, the original formula employs Glycericerae radix Gonsour licorice rather than the Glycericerae radix preparata Jura Gonsour, the prepared licorice, the honey-fried licorice, to underline the fact that it was being used not only as a harmonizing herb, but also for its tonifying and toxicity-resolving properties. Clinically, the formula may be used in treating any disorder for which deficient spleen qi is considered to be the root. At present, it is usually modified and augmented with other herbs in the clinic. Many contemporary practitioners base their treatment of childhood nutritional impairment on this formula. So there you go. That's Six-Gentlemen Zi Tang. Most of it is still the same for Liu Jun Zi Tang. We're adding in a couple of herbs that are going to be a little bit drying and a little bit moving downward. Chen Chen has some commentary as well. They say Liu Jun Zi Tang Six-Gentlemen Decoction is derived from Six-Gentlemen Zi Tang Four-Gentlemen Decoction with the addition of Ban Sha, Rhizoma pinellia, and Chen Pi, Pericarpium citrureticulate. It treats spleen and stomach deficiencies accompanied by damp and phlegm accumulation. Spleen and stomach deficiencies may cause indigestion, leading to loss of appetite and loose stools. Damp accumulation may block the normal dissension of stomach qi and cause qi reversal, manifesting as nausea and vomiting. When the spleen produces dampness, it is stored in the lung. If dampness stagnates in the chest and interrupts the flow of lung qi, coughing and oppression, distension in the chest, and epigastrium may occur. Profuse white watery phlegm indicates damp and phlegm accumulation inside the body. Renshen, radix rhizoma ginseng, baiju, rhizoma Atractylotus macrocephalae, fuling poria, and Jurgansau, radix rhizoma Glycericerae preparata Comel, which is honey, tonify spleen and stomach qi. Chen Pi, Pericarpium citrureticulate, dries dampness and regulates lung qi to reduce the profuse phlegm. Ban Sha, rhizoma pinellia, breaks up qi stagnation to relieve chest stuffiness and redirects rebellious stomach qi to relieve nausea and vomiting. Modifications. Interestingly, for a modification of another formula, Scheid and his team discussed several modifications for this formula. And here's the quote from there. Although it is a variation of Four-Gentlemen Decoction Six-Gentlemen Zi Tang, this formula has become a major formula in its own right, spawning a multitude of new formulas that take it, rather than Four-Gentlemen Decoction Six-Gentlemen Zi Tang, as their model. Some examples include adding Coptis rhizoma Huanglian, makes Coptis Six-Gentlemen Decoction or Huanglian Liu Jun Zi Tang, used for indefinable epigastric discomfort. This is according to the Comprehensive Medicine according to Master Zhang, the Zhang Shi Yi Tang, written in 1695. Adding Paeonia radix alba or Bai Xiao and Bupleury radix Chai Hu gives Bupleurum and Peony Six-Gentlemen Decoction or Chai Xiao Liu Jun Zi Tang, used for spleen deficient abdominal pain, menstrual pain, diarrhea during menstruation, and chronic low-grade fevers. And this is also from the formulary of the pharmacy service for benefiting the people in the Taiping era. Adding Atractylotus rhizoma Sangju, Bupleury radix Chaihu, and Simicifuga rhizoma Shangma makes the modern formula augmented Six-Gentlemen Decoction or Jiawei Liu Jun Zi Tang, used for chronic vaginal discharges. Probably the most commonly used variation of Liu Jun Zi Tang is Xiang Sha Liu Jun Zi Tang, which adds amomi, fructus sharen, cardamom, and Aucklandia radix muxiang, and makes zingiberis, rhizoma recens, shenjiang an explicit ingredient, so fresh ginger as well. This variation is even more drying and moving, such that it regulates the qi as much as it tonifies it. Chen has a lot of modifications of Liu Jun Zi Tang. For deficiency in cold in the spleen and stomach, add Wu Zhu Yu, fructus avodia. That is, totally blanking on it, but cloves. That's cloves. Pao Jiang, rhizoma zingiberis preparum. This is prepared ginger. And Ro Gui, cortex cinnamomum. That's cinnamon bark. If there's Zhang deficiency of the spleen and kidney, add Bu Gu Zhi, fructus cerealia, and Fudza, radix aconites, lateralis preparata. For diarrhea due to spleen deficiency, add Shan Yao, rhizoma diascorea, and Qian Shi, semen uralius. For hemorrhoids, add Huang Qi, radix astragali, that's astragalus, and Bibian Do, semen lab album. With mucus in the stools, add Gogen, radix puraria labate, Bai Xiao, radix peony alba, and Muxiang, radix aucklandia. With abdominal pain and cramps due to spleen deficiency, add Chai Hu, radix bupluri, Bai Xiao, radix peony alba, and Dong Gui, radix angelica sinensis. There's lack of appetite. Add Shanja, which is there we're going to be talking about next week on our next episode. Shanja, fructus crataegi, Shenchu, massa fermentata, and Maya, fructus horde germinatus. If there are exterior signs and symptoms, add Feng Feng, radix sapashnacovia, and Zisuye, folium perilla. For Ganji, or infantile malnutrition caused by yin deficiency, add Gochidza, fructus lychee, and Nugenza, fructus ligustri lucidi. For Ganji infantile malnutrition caused by food stagnation, add Maya, fructus horde germinatus. Sprouted wheat, basically. Comparisons. Tried it all because it's not a full formula in their thing. They usually would not compare it to other formulas, but it actually does. They actually do compare this formula with two other formulas. First is Open the Spleen Pill, or Qi Pi Wan. Both formulas tonify and regulate the middle burner qi and transform dampness to treat deficient middle burner qi that gives rise to diarrhea, belching, and lack of appetite. However, Open the Spleen Pill is better at dispersing food stagnation and also treating diarrhea. Six-Gentlemen Decoction Liu Jun Zi Tang, on the other hand, is better at transforming dampness and causing the stomach qi to descend. For cases of accumulation diarrhea where dampness is less significant, Open the Spleen Pill, Qi P1, is the preferred formula. The other formula is ginseng, poria, and white attractive lotus powder, Xingling Baiju San. Both formulas treat spleen deficiency complicated by the presence of phlegm dampness. Each can be said to embody the principle of cultivating the earth's spleen to generate metal lungs. However, Six-Gentlemen Decoction Liu Jun Zi Tang contains Pinellia rhizoma preparatum, Zherban Sha, and Citrus reticulate pericarpium, Chen Pi, both relatively acrid and drying herbs. It is thus better at drying dampness and transforming phlegm. This formula, on the other hand, contains bland and sweet herbs that promote water metabolism and secure the essence. That's the Shenling Baiju San, the ginseng, poria, and white attractive lotus powder. It is thus better at treating chronic deficiency disorders characterized by loss of essence or damage to the yin. All right, some biomedical indications. Chen say this formula has many clinical applications, including gastrointestinal disorders, abdominal pain, gastritis, chronic gastritis, gastric ulcer, duodenal ulcer, stomach prolapse, gastroptosis, indigestion, diarrhea, nausea, vomiting, morning sickness, stomach cancer, supportive treatment during chemotherapy, chronic bronchitis, stomatitis, which is sores in the mouth, pain in liver cancer, stress and depression, and neurasthenia. They also say it has regulatory effects on the intestines, protects the stomach, and is anti-neoplastic. So what does the science say? Chen lists several clinical studies with positive findings involving this formula. Abdominal pain with a modified formula in 123 patients. I always put the patient count because that gives the strength of the study. It's a quick way to look at strength of the study. Modified version was studied for treating morning sickness in 93 patients, chronic and acute gastritis in 207 patients, 31 patients, which is not statistically, well, barely maybe statistically valid. We usually want at least 30 to 40 patients before we can apply population statistics to a study. 31 patients used a modified version of this formula for treating duodenal ulcers. Stomatitis using a very modified formula in 130 patients. Indigestion, again, using a very modified formula in 60 patients. Chronic bronchitis in another modified formula for treating chronic bronchitis. I will change that. We'll look that up. 65 patients treated for pain from liver cancer with a modified version. No systematic reviews of Liu Jun Zi Tang were found on a literature search. Drug-herb interactions. A few herbs in this formula may present some risks for drug-herb interactions. There are 2 herbs that may cause cytochrome P450 interactions. These are Glycerin radix gansal, may induce cytochrome P450, 2C19 and 3A4. These are risk factors for drug-herb interactions, by the way. Ginseng radix ren shen may inhibit CYP, cytochrome P450, 2C9, 2C19, and 3A4. So both of these may affect 3A4. 3A4 is the most common of the cytochrome P450 interactions. One induces and one inhibits, so they might counteract each other a little bit. Who knows? But there you go. There was a case reported of congestive heart failure and hypokalemia, so that's too little potassium in the blood, and a patient taking gansal, furosemide, which is a loop diuretic. It helps, causes peeing and reduces water in the body, and digoxin. This is sea-level interaction, so it did happen in humans, but it's not super strong. Gansal may increase blood pressure and fluid retention when used with oral contraceptives, as shown in 2 case studies and an uncontrolled human study. So that again is sea-level evidence. Renshen increased the serum concentration of digoxin in a single case study, again sea-level evidence. In 1 case study, Renshen was thought to decrease INR in a patient stabilized on warfarin. So INR is a measurement of clotting ability, so it affected that. And again, this is seed-level evidence. The case study showed raised plasma levels of raltegravir 30 days after starting Renshen supplementation, which tapered off after stopping supplementation. And again, that's seed-level evidence. So what are some concerns about this herb, this herbal formula? Scheid and his team has some cautions and contraindications for Six-Gentlemen Zi Tang or for Gentlemen Decoction, which seem to be valid for Liu Jun Zi Tang as well. The long-term use of this formula may result in a dry mouth, thirst, and irritability. Should not be used without modification in patients with high fever, heat from deficiency, or a combination of irritability, thirst, and constipation. Chen say Liu Jun Zi Tang, although gentle, is slightly warm. Long-term use of this formula may cause dry mouth, dry tongue, thirst, or irritability. This formula should be used with caution or avoid in patients who have high fever, insufficient heat, excess heat, qi stagnation, body fluid deficiency, irritability, thirst, or constipation. Avoid cold or raw, pungent or spicy, and oily or greasy foods while taking this formula. And that is where we go today. So that was today's formula. Liu Jun Zi Tang, or Six-Gentlemen Decoction, a very useful and commonly used formula for treating spleen vacuity and phlegm. The combination of the paradigm formulas for spleen qi vacuity, Six-Gentlemen Zi Tang, or for Gentlemen Decoction, and for treating phlegm, 2H herb decoction, or Chen Tang. It appears to be a quite safe formula in general to be used under these specific circumstances. We start off by discussing 4 worrisome Chinese herbs. Actually, we didn't get into the 4 worrisome Chinese herbs. We talked about the evidence-based levels. All in all, this is another exploration into the fascinating and useful deep seas of Chinese formulas. In 2 weeks, we're going to be looking at another single Chinese herb, shanjia, Strategia fructus, or hawthorn fruit. This herb is in the Chinese medical category of herbs that relieve food stagnation. This is one of my favorite herbs, used for reducing food stagnation, moving blood stasis and clumping, and stopping diarrhea, as well as potentially having a role to play in helping cardiovascular disease and lowering cholesterol. As usual, we will explore all the intricacies of this herb, as well as an explanation of its category. And as always, we will look at something a little different. Join us in 2 weeks for another interesting episode. And I'd like to thank you very much for listening today. If you like this podcast, please do us a huge favor. Subscribe to our podcast in your favorite podcast app. We really appreciate that. We're on YouTube now too, so you can go check them out as well. And even just thank you for even thinking about doing that. And don't forget our amazing continuing education deal that we talked about at the beginning at www.integrativemenicineCouncil.org/CEUS1. And you can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. That's Spurbs Herbs, SPERBSHERBS.com. And as usual, we have a nice bibliography. Thank you very much.